My philosophy is based on a two-pronged approach. I think really, number one, how do you best treat the cancer, but then how do you best treat the person as a whole? So I think cancer therapy, a misnomer that often people think is that you're treating a disease, but the reality is you're treating a person. And so a cancer calls for a certain type of treatment, but every individual also has a special treatment that should be tailored to them. We're entering, I think, an era of what's called personalized medicine. And so that has a multi-pronged kind of approach where we're using targeted agents for a specific cancer type, but also we're targeting treatment that's more specific for that individual. And I think something like a CyberKnife is able to tailor things to an individual. Someone who was one of my mentors really told me that when you treat a person, you treat them like you're a family member so that they get the best care possible as if you would treat someone in your own family. The favorite aspect of my job is being able to see people through a course of treatment and follow them afterwards. I think that oftentimes we get focused so much on the treatment process that we forget about what it's like to really develop a relationship with that patient. So going from the start to the finish and then following them through afterwards is one of the most rewarding things, to see how someone's progressed through treatment, recovered, and is in a state of healing really from going through this whole process. So I enjoy getting to know the person, the families, and you really develop a bond with your patient. So what inspired me to go into radiation oncology? I think everybody has a little personal tale of some kind of run-in with cancer. Mine had a pretty profound impact on my life. The freshman year of college, I came home for spring break, beautiful day in San Francisco, went to Ghirardelli Chocolate Factory, and my dad hit me with a time bomb question and said, "Something's wrong with your mother." And it hit me, and he said, "Something's wrong with her breast." And it turned out she had advanced breast cancer, and so the next few months we're going through this process of treatment and surgery, chemotherapy, and radiation. And I really kind of got to know a radiation oncologist and met him that way. When I got into college, let me back up. When I progressed through college, I got involved in cancer research at Wake Forest University, and there I really got intermingled into the cancer center process there with the radiation oncology department, started doing research with them and just fell in love with it and developed a close mentorship relationship with some of the physicians that really kind of pushed me forward to want to go into this field. I think the things that motivate me most when I'm dealing with an individual is to show them compassion and love that's beyond just being their physician. I really want to communicate with someone that I care about them, that I'm not just there to take care of their problem, but I'm there to take care of them as an individual. And so I think that developing that close bond with a person and helping them through this whole process really is probably the most important part you can play. We have all kinds of fancy equipment and all kinds of fancy tools, but that only goes so far. And really, the compassion that a physician has with a person is really the most important part of your relationship with that patient. I think oftentimes as physicians we like to use big words and technical language, and it sounds great and fancy, but most people don't have a clue of what we're talking about. So I think really sitting down and having a real conversation with a person and their family is a very important part of their treatment process. It can be very overwhelming when you're diagnosed with cancer and you're trying to explain how the treatment's going to work, the prognosis. But ultimately, if they don't understand what you're doing, then you've kind of lost the whole game in general. So I think having multiple people there to reiterate things time and time again, actually nurses sometimes can simplify things and put them into terms that people understand. But I think sitting down, looking at a person face to face and having a real conversation with them is probably the easiest way to educate somebody. So CyberKnife is a very unique radiation instrument where we can pinpoint radiation specifically where we need it by minimizing side effects to other adjacent tissues. And I think that it's a revolution in this field where we can improve our tumor control rates, but we can also spare the side effects that people go through. And what I tell people is it's always a balancing act where we can do a lot of things to cure your cancer, but sometimes the side effects are really unacceptable because you want to maintain a person's quality of life. So I think CyberKnife is one of those instruments that allows us to treat someone's disease while not compromising their quality of life. So the whole process begins with your initial consultation with the physician. but we have a nurse that can educate the person. We have therapists and dosimetrists and physicists that all kind of work together as a team. This is really not a one-man show, and I think that if I tried to pretend that this was just my ball game, then I'd get in a lot of trouble. So I think having this support crew helps me to provide the best treatment, but also really helps the patient understand what they're going through. I think every single person is very instrumental to what we're doing on a daily basis, and the therapists that we have here are amazing in how they really develop these bonds with the people going through treatment to make them comfortable, and it makes their treatment so much easier on them. I think everyone's a little scared when they walk in these rooms, and our therapists doing a great job of really calming people down so they can get through treatment. When you integrate someone into a community of physicians that have specialties in these areas, they can work together to formulate the best treatment plan for an individual. A center like the Brown Cancer Center allows us to do that on a regular basis, where you're not getting the opinion of just the radiation doctor or the surgeon or the medical oncologist, but everyone kind of weighs in so that a person can walk out of here knowing that they've got the best treatment plan they can possibly have.